Okay, I think we're going to get started. We have a lot of great content to go over today, and I'm aware of everyone's time is precious. So thank you everyone for attending today. Well, I guess I have to start off. Not everyone would know me necessarily. My name is Dr. April Lucier. I am a member of the College of Nursing Anti-Racism Committee. And we are very pleased today to be able to bring Dr. Angela Cooper Brathwaite to present for us today in our Let's Talk About Racism speaker series. Her topic is the history of Black nurses in North America and their lived experiences. I just wanted to go through a little bit of an agenda before we get going. I've already welcomed you and introduced myself. We're going to do a land acknowledgement and then a little bit of housekeeping and talking about creating a safer space for giving an environment for open communication that we expect within this group. And then I will introduce Dr. Cooper Brathwaite, and she will give her presentation. That will be followed with a 5-minute break before we go into breakout rooms to discuss some interesting questions that Dr. Cooper Brathwaite has given us. And then following the breakout rooms, we're going to come back into a larger group discussion. And then if you have questions at that point for Dr. Cooper Brathwaite about her content that she shared with us, or about some of the conversations you had during your breakout rooms, we can do so then. Sorry, moment. Space. Aha. And today I have my colleague Victoria joining us to do the Traditional Territories Acknowledgement. I want to see if she's able to join us at this point. Okay, I'm not sure she has been able to join yet, or she's having technical difficulties. So for purposes of keeping with timing, I will read out our land acknowledgement. The University of Manitoba campuses are located on the original lands of the Anishinaabeg, Cree, Oji-Cree, Dakota, and Dene people, and on the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past and those continued harms of today. We dedicate ourselves to move forward in partnership with Indigenous communities in the spirit of reconciliation and collaboration. So a few housekeeping rules. We would ask everyone to stay on mute when you're not speaking, and then of course please maintain each other's privacy and confidentiality. There may be content that's shared of personal stories, etc., and we expect them to remain confidential. And that we ask you raise your hand if you would like to speak after, of course, the presentation, and that we respect each other's time to speak during that time. And we all have a part to play in ensuring that this is a safer space. So I will share our agreement for a brave space that we hope that everyone will abide by during this presentation and during the breakout rooms and discussion that follow. We have borrowed this from the EDI department from Rady. We will speak for ourselves and allow others to speak for themselves, with no pressure to represent or explain a whole group. We will listen with resilience, hanging in when something is hard to hear. If tempted to make attributions to the beliefs of others, we will instead consider asking a question to check out the assumptions we are making. We will assume good intentions without ignoring impact. We will keep in mind that understanding and agreeing are not the same thing. Stories, stay here and share the ideas. And we like to share with our groups because we know a lot of the conversation and content that we talk about can be heavy And if you need to reach out for further supports, this is our examples that we have here at the University of Manitoba and within Winnipeg as well. So please feel free to reach out to any of these or contact the College of Nursing Anti-Racism Committee as well for further information. And now to introduce Dr. Angela Cooper Brathwaite. She's the past president of Registered Nurses of Ontario, or RNAO, a co-chair of the RNAO's Anti-Black Racism Task Force, and graduate faculty member of the Department of Health Sciences, Ontario Technology University. She holds a PhD in nursing from the University of Toronto and a master's of nursing from the University of Manitoba. She is a national and international speaker at conferences and as well a keynote speaker. She has extensive experience in leadership nursing administration, nursing education, policy advocacy, healthcare systems, and cultural competence. She has held executive leadership positions as a director of nursing education and development, director of nursing and acute care, regional manager in primary care, program manager in public health, and president of RNAO. She has taught undergraduate and graduate nursing students in Ontario Technology University and the University of Toronto, respectively. Angela has received numerous academic and service awards, such as from the RNAO, an Award of Merit in 2015, a Leadership Award in Nursing Administration in 2013, a Leadership Award in Political Action in 2011, and has also received the University of Toronto Distinguished Alumni Award in 2007, Ontario Public Health Association Award of Excellence for Leadership in Public Health in 2010, and Award of Excellence from the Regional Municipality of Durham in 2006. She has published numerous peer-reviewed papers in professional journals. Her area of research are chronic disease focusing on the prevention of type 2 diabetes and culturally tailored intervention research for minority groups, sub-Saharan Africans, Black people from Canada and Caribbean, and Filipinos, and racism and discrimination among Black Canadians. Other areas of interest are listening to classical music, singing in choir, and visiting different countries. Thank you so much, Dr. Cooper Brathwaite, for being with us. I'll allow you to share your screen.
Good afternoon, and it's my pleasure and honor to join you this afternoon, and I look forward to our discussions at the end of this presentation. As a member of RNAO, I just want to say thank you for joining us, and I'm doing this on their behalf as well as the behalf of my other colleagues who have worked with me. So I will just get right into the objectives for the presentation today. I would like to define different definitions on racism, inform participants about the history of Black nurses in Canada, increase participants' awareness of racism in academic and workplace settings, disseminate research findings about the Black nurses and nursing students in Ontario, share strategies to address racism in nursing, and generate support for Black nurses who are experiencing racism in academic and workplace settings. So first, I'll start with the definition of racism, one of them. Racism is defined as a system encompassing economic, political, social, and cultural structures, actions, and beliefs that systematize and perpetuate an unequal distribution of privileges, resources, and power among white people and people of color. Institutional racism refers to the complex structures and processes which function largely independent of the prejudice or tolerance of individuals. Individual racism refers to the expression of racist attitude in the behavior of individuals in face-to-face situations. So what is microaggression? It's brief and everyday slights, insults, indignities, denigrating messages sent to people of color by well-intentioned white people who are unaware of the hidden messages being communicated. Microassaults, on the other hand, they are conscious, intentional, and discriminatory actions using racial epithets, displaying white supremacy symbols, like those that you use for the Jewish people, or if you see the noose, what they used to hang the black people on, if you see that outside the door, it's a threat to your life. Micro-insults, such as verbal, non-verbal, and environmental communications that subtly convey rudeness, insensitivity, that demean a person's racial heritage or identity. So the history of nurses in Canada, Black nurses, Black people in North America have experienced enslavement, segregation, lynching, and anti-Black racism for centuries. The experience of anti-Black racism throughout nursing history is evident in North America. In Canada, the first training program for nurses dates back to 1874, with the first Baccalaureate of Science nursing program started in 1919. Canadian nursing education institutions did not allow Black students into their programs until the late 1940s. Prospective Black nurses were instructed by Canadian nursing institutions to pursue nursing training in the United States with the enrollment of Black students in 1870. Black nurses were formally recognized in the profession with the graduation of Mary Mahoney in 1879, who became the first Black nurse to complete her training in the United States. Contributions of early Black Canadian nurse trailblazers, such as Bernice Redmond, Ruth Bailey, and Gwen Barton, were omitted in nursing education. These gaps in nursing education reinforce the historical harms within the Black community. According to Etowah et al. 2009 and Flynn 2011, they found that Black nurses are underrepresented in formal leadership positions, both in academic and healthcare systems. So we did a survey of Black nurses and nursing students in Ontario to uncover their lived experiences and with discrimination and racism. So in November 2002, a group of Black nurses and nursing students conducted a survey of 205 participants. And this group we call the Black Nurses Task Force. And just earlier this week, which was Wednesday, we launched our final report. You could find that final report at rnao.ca. And if you're interested, I could send it off to you as well. Participants completed a 25-item questionnaire comprising of 9 open-ended and 16 direct questions. The research assistant extracted the data from the questionnaires and separated the qualitative from the quantitative data for analysis. The eligibility criteria for the study were RNs, nurse practitioners, RPNs, which is similar to your licensed practical nurses in Manitoba, and nursing students who self-identify as Black. They were 18 years and older. They have worked in nursing or attended nursing school in Ontario, employed in any sector of healthcare. They consented to participate in this study. So I will share with you today 3 of the quantitative questions and 1 of the qualitative questions, because the report is very lengthy, just to give you a sample of some of what we found. So the quantitative research questions were, as a Black nurse in Ontario, do you believe that you have experienced racism and discrimination? On a scale of 1 to 5, to what degree has experiencing systemic discrimination and racial microaggression affected your mental health? In your view, for the qualitative, what is the single most important step to actively tackle anti-Black racism within nursing in Ontario and other jurisdictions? So the quantitative results. Of the 205 participants, 157 were RNs, 7 were nurse practitioners, 7 were registered practical nurses, similar to your licensed practical nurses in Manitoba, and 34 were nursing students. 88% experienced discrimination and racism. 63% said that racism affected their mental health. 19 worked in public health, 18 worked in primary care, 77 worked in hospital, acute care, 13 worked in home and community care, 12 worked in mental health, 1 in rehab, 11 worked in education, and the education comprised of clinical educators in the hospital setting or in clinical practice, or from a university or colleges. 2 worked in research, 3 worked in administration, 13 enrolled in post-secondary education, and 26 other, including the BSCN students. We had, out of 205 participants, 72 of them said that they were taught courses on anti-racism. Sorry, I need to restate that. 72 of the 205 participants said that they were taught courses on anti-racism, only 3, cultural competence, 36, trauma-informed care, 12, and 44 were taught race as a social determinant of health, and it dealt specifically with Indigenous peoples. The qualitative findings. 5 themes emerged from the qualitative data, and they were awareness and acknowledgement of systemic racism in nursing, education and training, mentorship and financial support, changes in hiring practices, and diversity, equity, and inclusion committees. So I will address each theme separately. I might give some quotes and I might omit some quotes, just to keep the length down. 24 participants identified that leaders' awareness and acknowledgement of systemic racism were important to addressing racism. Awareness and acknowledgement of systemic racism in nursing is described as recognizing the existence of racism in nursing and the broader society. Quote, "The most important step for me is for non-Blacks to acknowledge that anti-Black racism is alive and well in all facets of life in Ontario or other jurisdictions, and work with Black leaders to compassionately and honestly address this issue. These systems were not built to include us, and every effort must be made to make space for us, Black nurses, to peacefully coexist and thrive within the nursing profession. Leaders should engage in meaningful dialogue with Black nurse leaders, collaborate with Black nurses and nursing students to develop strategies such as including policies of zero tolerance of racism in their institutions, with providing mandatory education for all levels of employees on what racism is and in addressing it. Racism and discrimination should be placed on the agenda of the government tables to make it a priority for healthcare leaders, healthcare practitioners, and academics to mitigate. The use of media as a platform to increase awareness of systemic racism in nursing. Leaders should collaborate with racialized minority nurses to address systemic racism. Create reporting systems and monitor leaders' performance. Educate non-Black nurses and community members and governments, regional, provincial, and federal, about systemic racism and discrimination in nursing. So team 2, 25 participants identify education and training as an important strategy. Education and training are referred to mandatory courses which focus on cultural safety, anti-oppressive behaviors, anti-racism, systemic racism, trauma-informed care. These mandatory courses should be included in orientation and continuing education programs for all staff middle managers, and leaders in executive positions in academic and healthcare organizations. Team 3 on social support. Over 14 participants highlighted the importance of mentorship and resources to advance their career and attain leadership positions. Mentorship was described as a process of learning through a mentor-mentee interaction, which increases the mentee's knowledge, skills, and abilities to achieve the career goal. And I would say mentorship has benefits for both mentee and mentor. Team 4. Changes in hiring practices. 17 participants identify changes in hiring practices as a strategy to improve equity and fairness in recruiting, hiring, and promoting Black nurses. Changes in hiring practices refer to hiring Black healthcare professionals, that includes nurse practitioners, RNs, and RPNs, who have the knowledge, the skills, and academic credentials to fill vacant positions, whether it's in administration, executive leadership roles, and specialty areas like ICU, maternal child care, as well as government agencies. And one of the quotes, and I'm just going to say it, is some of the students said they felt so isolated during clinical practice. In their last semester for the consolidation experience, they were placed in long-term care. They never got the preference as to work in acute care or public health, always in long-term care. So they were set up to work in long-term care after they finished graduation and wrote the NCLEX exams. They said, some of them said they never had a Black teacher. And I will tell you for myself, although my results are not in this study, I have graduated from 3 Canadian universities, from 3 different provinces, and I never once had a Black teacher, whether it's undergrad, master's program, or PhD program. So these Team 5, and Team 5 looks at equity, diversity, equity, and inclusion. And this is becoming now something very important for nurses to start working in this area. And I'm getting all these things that come into my screen, sorry. Participants acknowledge that the DEI committee should be established in all institutions to address racism. I know in the United States, they have done this in many universities and workplaces. And I know for some provinces, they're just starting, and some are more established than others to have a DEI committee. So we describe a DEI committee as a group that includes representation from employers, staff, and volunteers from all backgrounds who oversee and investigate equity, fairness in practices, and complaints of racism in the workplace, and take corrective steps to rectify issues and concerns. This committee must have decision-making power to be effective. And I could tell you the University of Toronto, they have established a DEI committee, which is made up of some alumnus. It's made up of current students, staff, the Dean of Nursing, and they also have some subcommittee, and I sit on one of the subcommittee, which is called the Black Nurse Health Working Group. And they also have they have an Indigenous Nurses Interest Group. So they add advisory group to the DEI committee at the University of Toronto. So we like to look at some strategies to address racism in academic settings. Don't hide the problem. And I say this to you students, and I say this to you staff workers. If the problem exists, go to your immediate supervisor, be it the dean or whoever is in charge, and report it. You need help because racism causes mental health problems, okay? Don't hide it. Seek help from your advisor, your executive nursing leader, whether it's the Dean of Nursing or Health Sciences, to share your stories. And I know when I experienced racism on undergrad, I told my peers, I was the only Black student in my class, by the way. I share it with my peers. I got support from my peers, okay? I went to the Dean of Nursing and explained what was happening. Don't be afraid, because keeping it silent, you're doing yourself harm. Racism causes trauma. It increases your stress level. It increases your anxiety level, leads to depression, and even the perpetuation of racism could lead to PTSD. So share your stories. And that's why we need safe spaces for people to voice their concerns. Share your experiences with peers to get emotional support and understanding. Seek help and support from mental health services at your university. And if your workplace doesn't have it, some people in our study said they had to go to private agencies to get support rather than having it from their employer. Their institutions did not have that kind of service. Other strategies to address racism: advocate for changes in the curriculum to require ongoing anti-racism education for students and to include racism as a social determinant of health. And for our AGM, which is coming in June, we have a resolution going forward for racism to be as a social determinant of health, should be included in undergrad and graduate curricula in the province of Ontario. Through your student council, advocate for trauma-related support for those of you students who are in academic setting, if you have experienced racism, because it causes harm. Advocate for nursing students or racialized students to enroll or admitted into programs such as the FIAT program, that's one at McMaster's University, or the BSAP, which is at the University of Toronto Medical School. There are different organizations now that are making themselves available for people who have experienced racism so they could get the help and support they need. Strategies to include racism in the workplace. Advocate for employer to implement a diversity, equity, and inclusion committee in your workplace or your nursing faculty or school. Diversity, equity, and inclusion committee should not be a one-person endeavor. And I know some organizations in Ontario, hospital setting, they have a one employee. I would say with a pervasive problem, a one employee member to deal with racism is far from adequate, okay? So with just a director, you need somebody who has decision-making power to be at the head of that committee. Staff, get volunteers from the committee who have experienced racism or from the racialized groups to sit in that committee. So you could bring in external people who are willing to work with you, volunteers to help you to work on this problem. Advocate for policies of zero tolerance of racism in the workplace or education setting. And on Tuesday, I mentioned about the zero tolerance. They were asking me what my number one recommendation would be to address racism. And I said, it's policies and practices, a policy of zero tolerance. And I was brave enough to say, when you have code white, code blue, everybody knows what that code is. When you call that code, you get people come to that code to give assistance. I said they could develop a code purple for racism. You have to have your policy in place, code purple, and people from other parts of your institution could come to that place where the code purple is. It will help to change behavior. But you also need not only have policies in place, you need to educate your staff, your managers, your senior executive, so they know how to manage this problem. You're having a leadership role does not entail that you know how to deal with it. You need to have the knowledge and skill how to deal with this problem. It is not easy to deal with it. And sometimes the more you talk about the problem, for sometimes you get that catharsis, and sometimes you relive the experience would further traumatize you. So get the support you need to help you fight racism. So some strategies I would suggest in the workplace is assertiveness training. And the purpose of this educational session is to enhance health professionals' knowledge and skill in using assertive behavioral strategies. Assertiveness is necessary for effective communication in nurse to patient, nurse to nurse, nurse to multidisciplinary team members, and nurse to their leaders. It also includes aids in developing confidence and effective communication skills when speaking to others, to avoid manipulative and bullying behaviors of others. So let's start by defining assertiveness. Assertiveness is an interpersonal behavior that is defined as that which attends to and informs others of one's own needs and feelings and send a message to others in such a way that neither the person is belittled or put down or blamed. And I know for those of you who are in mental health or who have done mental health courses, you learn how to be assertive. Assertive behavior is described as a person giving expression to his or her own rights, thoughts, and feelings without denying the rights of others. In other words, assertiveness is based on balance. It requires being forthright about your wants and your needs while considering the rights and needs and wants of others. On the other hand, aggressive behavior is based on winning, while racism is based on traumatizing others. The aggressive person does what is in his or her best interest or their best interest without regards of the rights, needs, feelings, or desires of people. So it helps you to become more self-confident. It helps you to make great managers, leaders. They get things done by treating people with fairness and respect who are treated by others in the same way. They're able to negotiate successfully. It's a win-win solution. An assertive person recognizes the value of their opponent's position and quickly finds a common ground with that person. It helps you become better doers and problem solvers. The assertive person feels empowered to do what it takes to get the best solution to solve the problem. So now I have opportunity to ask questions.
Thank you so much, Dr. Cooper Brathwaite. I believe the way that the settings are right now is people are not able to unmute yet. So I'll just ask IST,
Okay.
Teddy or Mike, if you could allow participants to unmute, or if people are more comfortable, if they'd like to write in the chat, we can filter through the questions in that way.
Because I haven't concluded, I usually stop to ask questions before I conclude. It's not concluded
I see.
yet.
Yeah. Okay, thank you for clarification.
It's not concluded yet, so.
Okay.
So if people don't have any questions, I'll go on to the conclusion.
We have one from Amy Rodriguez that says, what does zero tolerance policy look like?
It's something you have to generate. It's zero means, and before I give you that answer, I would say you could get racism from your clients. And some of the nurses in this study say the clients call them the N-word or say, I refuse them completely. I don't want so-and-so to take care of me today, okay? So if you are assigned to a patient and that patient says that to you, could you imagine how you feel, okay? So you could have it from client to staff, peers to peers, leaders to their staff, or vice versa, okay? And if you have a racism from those different categories, how do you get zero tolerance? And I mentioned the code orange, and that's just an example. I just throw it out there. If you have a policy says, we uphold zero tolerance, just like with a code white says zero tolerance to physical and verbal abuse. So, and there are consequences attached to that code. Similarly, if we have a zero tolerance for racism, if your peer complains, sees the manager and say, I had experienced racism, and define it, has it written, say when it happened, what happened, there are consequences to that person who perpetuated that behavior, okay? That's what zero tolerance is. It means it's not tolerated from anyone, be it from your patients, from your visitors, be it from the staff, from your peers. your multidisciplinary team, your managers, whoever, there is no tolerance for it, and there are consequences for your behavior.
Thank you. There's one more question.
Okay.
From Omar. Is there a difference between practices that help Black people versus Indigenous people in regards to racism?
Could you repeat the question, please? Sorry.
No problem. Is there a difference between practices that help Black people versus Indigenous people in regards to racism?
If there's a difference in practice between Black people and Indigenous, I'm not sure I understand your question. Sorry.
Yeah, that's just how it's written, and I'm not 100% sure either. If that person would like to clarify.
Yeah, clarify.
You can unmute yourself now to the participants, or we can move on, I believe.
Yeah, I'm not sure if you're comparing Black to Indigenous, dealing with racism. I'm not sure what the question is asking.
Yeah, I'm not.
I can clarify if
okay, perfect.
Yes, go ahead.
Sorry, I know it's a confusing question, but I was just trying to ask, like, are there particular practices that you think would help, for example, Indigenous people more than Black people and vice versa?
I think the practices are the same. I think you still have, whether it's an Indigenous person or Black person or somebody of color experiencing racism, you do take culture into consideration, because culture does have some impact in behavior and how we behave. And one of my PhD was in cultural competence. So depending on the culture the person is coming from, you have to take the cultural beliefs and practices into consideration when you apply some of these policies or procedures. That's the only caution I would give. But if somebody has experienced racism, it has the same impact on the Indigenous person as it would have on the person of color, be it Black, Chinese, or whatever. But culture plays a major role, and cultural safety is very important. And also, too, when you look at culture, some of our behaviors could be misinterpreted, because if the person who is interacting with us does not understand our culture, they might misinterpret behaviors. For example, if you're talking to somebody who's Japanese or Vietnamese, they lower their gaze, or they don't give you a full gaze, okay? When Black people, we're watching your full face, and my mom used to say to me, you stop staring at people. You need to lower your gaze, lower your eyes, right? And you can't generalize either, because that's where I recommend people doing a cultural assessment on every person you admit into your hospital. So you understand where they're coming from, so you're better able to provide client-centered care for them. Because culture determines our behavior.
I think that makes perfect sense. Thanks a lot, Professor.
You're welcome. Any other questions before we go on to the conclusion?
We have one more in the chat.
Okay.
Is emphasizing an assertive personality placing too much responsibility on the individual and not on policy change to address issues such as racism?
No, I don't think being assertive is putting too much responsibility. And I will tell you, I learned assertiveness training in Winnipeg when I was working there. I work in mental health at the Victoria Hospital beside a maternal child. I learned assertiveness there in working in the different groups in mental health there. No, assertiveness being, I respect your rights and I respect your rights. And if I respect my rights, I am not going to take advantage of you, okay? I will acknowledge where you're coming from, listen to what you have to say, try to put myself in your shoes, as the Native people say. I work in Northwest River with the Native people. Never judge a man till you've walked 3 moons in his moccasins, okay? Try to understand where they're coming from, so you have a better idea how to approach them. But assertiveness being, I have a right to my feelings and my views, but I should not impose them on other people, and others. So similarly, other people have the rights to experience and views. And you have to learn to listen, see where they're coming from, and come to some workable agreement. It's not putting too much pressure. I would recommend everybody become assertive. It has served me in so many instances, because I've learned to sit back, think, reflect. Where is this person coming from? Even if I walk away, I go home in the evening and I reflect. And I do a lot of reflection. At the end of the day, I think about situations or things I've gone through for the day and think how I would approach them differently. And sometimes I have to go back and apologize. I did an interview on Wednesday for one of the newspapers in Ottawa, CBC newspaper. And she was asking me to relay some of my experiences of racism. And I became quite loud. I'm emotional. I became quite loud. And afterwards, I apologized. I said, by reliving, when I spoke to you about those experiences, I relived them. And the emotional impact that I had experienced then in the past came right back. So you see, talking about it could cause you emotional release. But when you're repeating it over and over, and that's why I said to people, I learned to forgive people who've hurt me, who are racist towards me, because I said, if you know better, you will do better and move on. And I don't dwell on it because it could cause self-harm. So if there are no other questions, I'll go on to the conclusion. So discussion. Black nurses, students, and racialized groups need safe spaces to voice their concerns or their problems. Mental health programs at universities, workplaces should include trauma response teams to deal with racism. Mandatory health equity, anti-oppressive, and culturally safe training for teachers, student healthcare workers, etc. Funding to create culturally safe spaces to facilitate growth and development for students. Learn to recognize and understand your own privilege and use it to dismantle systemic racism. Examine your own biases and consider where they originate. Validate the experiences and feelings of people of color. Discuss oppression and discrimination. Call out racist jokes or statements. Remember, all forms of oppression are connected. You can't fight against one and not the other. And I will tell you, I work at a certain agency, and I'm not going to say where it is. It was in Ontario. And we had a manager, white manager. He used to make these racist jokes, at staff meeting, general meeting. And I remained silent. And I was new to that organization when he was doing that. And I had to stop and think, how am I going to address this? I never laughed. All my peers were laughing. I never laughed because they were racist jokes. I kept a serious countenance until I knew him well enough to approach him and said, do you know how people feel when you make that joke? Do you really know what that joke means? And raise it with that person. Okay. So I am telling you, you have to reflect. Sometimes you don't know the answer. You don't know even how to address it. And maybe you need to go to somebody else and say, so-and-so was said to them. I felt very uncomfortable. How would you address that situation if you had to face the same thing? And go to somebody else, get a sounding board, somebody to help you. We don't have all the answers to the questions or the things that we would experience, but we could learn from our experiences. We could learn from other people and how they have worked through different situations. We are all in this together. We are all learners. We are lifelong learners. I don't have all the answers. So, in conclusion, anti-racism action include leadership buy-in and commitment with dedicated resources. You have to put some resources to it, whether it's a DEI committee or whether it's training and education, support. Funding, you have to put some funding towards it. If you don't put some money towards it, it's not going to get done. Leadership buy-in should be at all levels of academic and healthcare and government institutions. We would recommend a multi-level, multi-pronged approach to address systemic racism with policy and organizational interventions with transparent, accountable measures for sustained change. And I would end with a quote from Dr. Martin Luther King Jr. And I quoted this earlier this week too. injustice for one is injustice for all. If you have come here to help me, and some other people would say this, if you have come here to help me, you're wasting my time. I'm talking about intersectionality now. You know, sometimes we go into different cultures and we think we have all the knowledge and we want to help people, okay? And sometimes the people are resentful because you might have good intentions, but your approach is not right. So the quote is, if you have come here to help me, you are wasting your time. But if you have come because your liberation is bound up with mine, then let us work together. And Lilia Watson said that. Let us strive to dismantle racism in our schools, our workplaces, and society at large. We all, as nurses, we have a collective responsibility and accountability to do so. Our Black peers or racialized group, they are our peers. We rub shoulder together with them. And if you are having difficulty, you would expect them to help you and vice versa. We are in a helping profession. Nursing is a helping profession. We have to help one another and learn to live in harmony. Thank you very much. So there are the references and so forth. If you have any other questions, I'm willing to ask before you go into break up groups.
Perfect, thank you.
I only shared one of the qualitative questions. So if you want the report, I could send that for you, April.
I would love that, absolutely. If you would like to share it with us, we can share
Yes.
it amongst the entire college.
Okay.
That would be fabulous. I would love to see it.